Practitioners, Pharmacists and Dentists Union has raised concerns regarding the recently enacted Social Health Insurance Bill 2023, expressing skepticism and outlining potential repercussions. The union officials lamented being ignored by the Parliamentary Health Committee after being promised that their concerns will be addressed, only for them to see the law enacted without their issues being addressed. Aluda Gael now reports.
Makes us strong.
The Kenya Medical Practitioners, Pharmacists and Dentists Union has raised concerns over the enactment of Social Health Insurance Act of 2023, saying that if adopted, at least 3 million Kenyans will be deducted up to 8,500 monthly of Kenyan shillings without the comprehensive cover nor the surety of access to service.
Comprehensive medical cover for all the civil servants and the county employees and their dependents will cease to be in existence once this bill is adopted. And what it means is that more than 500,000 civil servants with their dependents, that's totaling to about 3 million Kenyans, will not be able to access care as they ought to be.
Terming it as a gross injustice and a breach of duly signed collective bargaining agreement of 2011 on the provision of comprehensive cover by the employer. The union says that with 80% of people working in the informal sector, the adoption of the law will hurt them by forcing them to contribute upfront the entire annual amount, unlike their formerly employed counterparts who will contribute monthly. The law further takes away their right to health care as envisioned in Article 43 of the Kenyan Constitution.
It must come out very clearly that these civil servants with their dependents must be given a comprehensive cover, and if that is not possible, then their medical allowance must be returned forthwith. And that's the demand we are giving to government on that. And we are not just giving that demand because we are going to take also legal address over that. Because with the Social Health Insurance Act as it is, it breaches the constitutional requirement at Article 43 and also the collective bargaining agreements of the union and the employer.
Further, KMPDU demands that with the taxpayers footing the expenses, the union wants the funds to be disbursed to the counties by the Commission of Revenue Allocation and not managed by Social Health Authority, as this will undermine devolution and affect service delivery by the perennial delays, as it has been witnessed in other sectors.
The level 1, 2, 3 must be accessed. Then these funds need to be disbursed ante to the hospitals within level 1, level 2, level 3. These funds need to be provided to those counties so that the counties can actually employ health workforce, so that the counties can actually buy the drugs, because these are tax-based funds.
The union also raised concerns over the Social Health Authority Board developing regulations without the input of all parties, including the Council of Governors, who are the key stakeholders, as the health function is a 90% devolved unit.
So we are saying that the governors need to be awoke. We are saying that the medical associations, the civil societies, the patients, the Kenyans in general must look into it, that the bills that have been enacted, will it make them access care, or will it exacerbate their suffering to the point that a few individuals, a few private profiteers will benefit from it.
Aluda Gael for Look Up TV, Nairobi.